So, oh, I guess I'm being recorded. So that's the internal control deficiency. Is it gonna, oh, and that is the end of the presentation. So what I'll do, let me get this off the screen. And like I said, I'll turn it over to the group. And if there's any questions or anything that you would like me to go over in more detail, I'm happy to try and do that as best I can.
Okay, thank you very much. I'm a member of the Finance Committee, and I benefited from a longer discussion of this at our meeting with Virginia. And so I appreciate hearing it again, though. Thank you. Jim, you had a question. Go ahead, please.
I have a comment and a question. I want to recognize your efforts over the years, Chuck, to bring in a new pair of eyes, and you kind of led the charge to bring in a new firm this year. So thank you. I think the benefit of that is showing itself. The question I have is, we discovered last year that we have this, the CalPERS survivor benefit. We hadn't paid the premium in 30 years, and that created a liability for the district for that benefit. I don't think we know the nature or extent of that liability yet, but I would ask Mr. Edelman, was that considered in your review, and would that be considered material?
So I can tell you the total CalPERS liability combines different things, and that is certainly, that big number is part of the audit. I probably can't give you a good answer specifically on a survivor benefit without, I guess, going back and doing a little research, though.
Were you aware that there was this unpaid premium?
I don't know I don't know the specifics of what you're referring to.
Chuck, I would, I would defer to you, and in your role with the Finance Committee. I'm a little surprised that wasn't brought to Mr. Edelman's attention during his review. I would think that would be, again, it was discovered. We know it's created some liability for us, and how are we handling it within the context of this financial report?
Yeah, thank you for bringing that up. I mean, you raise a good point, and I was just going to suggest that Virginia is actually chair of the Finance Committee this year, and I would recommend to Virginia that we actually put that question on the Finance Committee agenda to find out more about that. But I think, as you know, and thank you for the kind words a few minutes ago, we need more horsepower in the financial group, and I've been arguing for that for a very long time. And this is a matter where we had to restate our position by $2.2 million. That was taken away from our reserves. Now, nobody stole it, and it wasn't a matter of any wrongdoing, and there was nothing untoward about it except either incompetence or inattention or something on the part of both our financial staff in-house and our auditor. And I'm also going to recommend that the Finance Committee look into that, because an auditing firm has certain standards, and I think in this case they weren't met. And to me, it's not, as a member of the public, it's not satisfactory that somebody could not do their job and that there's no penalty for that. And I think there needs to be either a complaint made to the standards board or to the organization or something, but this isn't the place to be discussing it. But to your question, I think we should look into it. I'm not familiar with what was done on the audit. That's not something the Finance Committee has brought into at all.
Yeah, so Chuck, if I may, I think this was the first time that, when we saw this, that we learned about this problem. And the presentation. First of all, thank you very much, Nathan. I think is a starting place for a discussion. So if this is something that the board would like for the finance committee to continue or to look at more in depth, I would agree that that's something that we should do. And we can certainly put it on the agenda. And actually the board right now can direct that this go onto the finance committee agenda.
Yeah, and let me just clarify that Nathan is just brought in to do this after the close of our fiscal year last summer. I don't know when it was exactly, August and September, when the appointment was made, but he's the messenger here. He's certainly not the person responsible for the problem. He's reporting it to us.
Correct.
And, I appreciate it having it be reported to us, but how that information then gets passed on to him, as he said at the beginning, I don't agree with him 100%, by the way. I think the auditing firm has more obligations to us than just being the messenger of information. But I nonetheless, this is something that we should have informed him of, because there's no way from him going through our file cabinets or looking at our books that he would know about that issue.
Yeah, let me just piggyback on that, Chuck. That the Aid Bailey is the new auditor that I think Long Limb, I think I can't remember who the third person was on the committee to select the new auditing firm. We ended up, I think, picking the right firm, Nathan. So again, I think that if this is something that we want to put on the finance committee agenda, we should direct the board, or to have the board direct that to happen tonight.
Chuck?
Yeah, let me make sure, Jim, did you get your question answered?
Yes, I did. Thank you.
Okay.
Thank you.
So is that a request, Jim?
No, pardon my oversight, Virginia, for not recognizing.
Oh, no problem. But if that's a request, then I think that we should, if the board wishes to do that by consensus, we can put that on to the next finance committee agenda.
I'll leave that in your hands, Virginia.
Okay.
Okay. Rob, go ahead, please.
Yeah, thank you, Chuck. We just kind of glanced over the CalPERS liability. Can you give us an approximate amount, Nathan, as to what our CalPERS liability is presently?
Oh, yeah, that I can do. Hold on. I don't. So I can. So if you, the number is 38,704,411. If you're following along in the report, I don't know the PDF page numbers. Yours is a little bit different, but on the financial statements, page 25, it does have a line kind of in the middle. It's under liabilities, and it's the aggregate net pension liabilities, which is at 38.7 million. Okay. And there's actually it's called the footnote, but find the note in a second. Hold on, pension. So note 7, called pension plan, which is on page 48 of the report. And I don't know if you want me to spend too much time on this right now, but I mean, someone could open this up and probably spend a couple hours just walking through this note. It's quite lengthy. And it does have a lot more information about the inputs, the assumptions that arrive at that actuarially calculated number. It splits it between, there's the miscellaneous and the safety, and there's an interesting disclosure, but changing the discount rate plus or minus 1%, what does that do to your liability? It's a huge swing. So I could probably talk a lot more about that, but 38.7 million, I guess.
Okay. All right. Thank you. Thank you, Chuck.
You're welcome. Any more questions from the board on this? I'm happy to take public comment if there's any public comment on this item.
Anybody has any public comment? You could raise your hand, or you can press *9 if you called in. And I see none.
Okay. Yeah, I just want to summarize the lesson from my perspective on this, and that is that we basically wrote off a little over $1 million based on not having the right balance of funds from the prior year. And then for the year operation that just ended, another $1 million. Yeah. And this was because the reserve wasn't calculated according to the formula that's required to be used, which is to use an actuarial study to determine what the liability is. This is something that I'm going to bring up to Virginia, and I'm mentioning it now in case anybody has an objection to it, but I'd like to challenge or ask nicely our prior auditor on what basis this was made and to see if there's a defense there, because no disrespect at all here to Nathan, but I think they deserve the right to at least answer the question about why they took an alternative procedure. On the face of it, it doesn't seem like it was an authorized procedure, but they took an alternative procedure to calculate this. And I think we ought to at least hear what they have to say. So I would be inclined, I could do it either as the board president or I could wait for the finance committee meeting, but I would be inclined to write them a letter and just ask the question. This has been raised by our current auditor, and we would like to understand on what basis the reserve was calculated, and see if they have a reasonable response before somebody like me jumps off and starts making accusations that may not be justified. But I wanted to know if anybody felt uncomfortable with this being pursued in terms of a question to them. Okay, well, hearing none, then I feel authorized. I will send everybody a copy of the letter, but I would like to inquire about it, and I'd like to do it sooner rather than later. So I'll do that as the board president if there's no objection. Okay. Anything else for Nathan before we thank him? Okay, Nathan, thank you very much for the report.
Thank you.
We will, I think, look into this a little bit more at the next finance committee meeting, which will be about the 1st of March. So we'll have a question and get some information from you at that time.
Okay. Yeah. All right.
Thank you.
Thank you, everybody.
Thank you, Nathan.
Item number 2 is our fire chief report. And I'd like to take this opportunity to welcome, I should have done at the beginning of the meeting, welcome Chief Mark Lorenzen to his first board meeting and his first board report. So we're all going to get copies of this with his signature on it for us to put into our historic file of the fire board. Go ahead, please, Chief.
Yeah, President Bernstein, board members, fellow employees and members of the public that are listening in. Thank you. Had I known this was going into the museum, I probably would have worked on it harder for my first report. But with that said, it's well, first of all, it's an honor to serve as the district's fire chief. I feel incredibly fortunate to be here, living in Menlo Park. For those that don't know, I now reside in Menlo Park proper. I'm really wonderful to be the local fire chief that's part of the community that I protect. So thank you all for that opportunity. With that, I anticipate that future board or fire chief's reports will probably be a little bit longer than the first one. My first day was a week ago Monday, and it was a very interesting fresh start. We had, and that's part of my first thing, is we had a COVID outbreak at our 170 Middlefield administrative building. So there was a number of people, probably key people, that were out. And that being said, it gave me the opportunity to work pretty closely with those that were there and get to start knowing people at our admin building and some of our other locations. Quick update on COVID. Obviously, the Omicron variant has impacted the fire district pretty hard. As we see in the report here, we've had 49 employees out since late December with the virus. 12 of the 49 have been unvaccinated, and the remaining 37 were all vaccinated. I think that's probably a close approximation with our vaccination numbers and percentages. It's not surprising. This variant really doesn't discriminate much from the vaccinated and unvaccinated. What we see is that the impacts of the virus on the vaccinated tend to be less. We have started mandatory testing. We're doing it on at the first shift back for folks that are on shift work and on the Mondays at our administrative buildings. That's been helpful for us in catching any of the positive cases and sending folks home to work remotely too. So we've also seen that our impacts at the hospitals have been on the basically on the downslope. Yeah, so basically, initially during the big spike, we saw there were some challenges with hospitals and wall times, with the ambulance service being degraded. Lately, we've not been seeing that, which is great. So we're seeing, us on the downward curve, which is good for us. Other things going on. We've got a couple of consultants, one that's already started with us, that thanks to the board was approved to help us out on the budgeting and finance side. I know Bill has already met with Long and is working with us to assist us in the budgeting process and reviewing some of our internal procedures. We also have our management audits starting with AP Triton Consultants. I just had an email from one of the consultants, hopefully scheduling an interview, an entrance interview with us in the coming week. Looking forward to working with AP Triton on that and hopefully finding out if there's areas that we can have some improvements in. Incident-wise, we've had a couple of significant incidents since the last board meeting. One was in East Palo Alto on Shembry Lane. Unfortunately, a family was displaced, but we engaged the services of Red Cross, who helped with relocation assistance and issued what we call a safeguard to the family. There's no injuries there. And then we had another fire on the El Camino in North Fair Oaks. It was a commercial structure fire that started on the outside, started spreading to the building. Unfortunately, we had a quick knockdown from our local firefighters. I know there had been some pictures shared from it that were pretty impressive by board members, but really was a great actions on behalf of our folks. So that's really it for this month's board meeting, fire chief's update. Like I said, as I get my feet on the ground and visit with more folks, I'm sure it will be a little bit more lengthy. I will share, I've already reached out to all of our city managers, have already met with some of them, and also have meetings scheduled with our police chiefs. And I will be the guest speaker at Atherton's ADAPT on Saturday, March 5th. So looking forward to sharing our readiness and some experiences with the community. For that is the end of my report. Thank you again for your faith and trust in me, and looking forward to serving many years as your new fire chief.
Thank you. Robert, I see your hand. Please go ahead.
Yes, Chief, thank you and welcome aboard. Do you know, out of the total number of employees that we have, how many of them have been vaccinated and how many that are not? Do you have a handle on that number right offhand?
I am going to call on my subject matter expert, Francine, if she's still on. I bet she has those numbers.
Hi, Director Jones. So I don't have the number in front of me, but I know that percent. So my guess with standard deviation is that we're still kind of about that number, 80%.
80% that are vaccinated?
That's correct. And I can get clarification from our DICO, but I believe that's what it is.
So out of the, if I may just kind of indulge myself, so out of the 145 people, assume that we have on board, we're looking at somewhere in the neighborhood about 116 that are vaccinated, and then balance of that number is not, which is about 29 folks. Okay.
That's what I got too. That's correct.
Okay.
And
So,
again, I'm rounding.
yeah. So the lead to that is that of the number that was presented, Chief, in terms of you mentioned there was, I don't forget, 49 employees that are unvaccinated. I guess out of the 49 that were out, 37 of those were vaccinated and the others were not. So I don't know. I guess I'm really trying to understand how of the 29 that, and I know people, you can go somewhere and you can pick up the virus and bring it back. And I know that, being able to get tested will help to kind of catch some folks. But is there any data or understanding of the 29 if, because I know we talked about it before in terms of being able to whether there should be we should go down the road, and I think Chuck may have brought it up before, I'm not sure, but someone in terms of having a mandate for that everyone in the district get vaccinated. I'm just wondering if we have any idea about those that are unvaccinated, whether of the total number that went to the hospital or was out, with any of those 29 a part of that?
So I don't have any data on that. I can certainly inquire and get back to you with that. I will say, coming from an organization that had a vaccination rate of about 52%, I feel very fortunate to have landed in one that's north of 80%. The vaccination hesitancy is so strong, and it's, I would just say, in my last organization was incredibly divisive. The last couple of years have been divisive, just politically, vaccination-wise, COVID-wise, masking-wise. So even though I am a firm believer in vaccinations, I'm not necessarily a really strong supporter of a vaccination mandate unless we see that we have a specific issue we're trying to address. With that being said, obviously it's a policy decision from the board, but along with that comes some challenges and consequences that I was watching Los Angeles County and City deal with to the south of us, with employees and releasing employees and some other issues. But, that's really my comments related to the vaccination. I don't know if there's more questions related to that. I will also say, because I forgot to include it, we've seen that the state and CDPH has changed the requirements for masking, and the County of San Mateo has followed the CDPH's guidelines. And so tomorrow we will be changing our masking guidance also. So it differentiates between those that are vaccinated and unvaccinated, and allows for indoor unmasking for vaccinated employees. So hopefully that serves as some sort of incentive for those that have chosen not to be vaccinated to maybe perhaps get vaccinated. But anyway.
Thank you.
Sure.
Thank you.
I have a question. Were there any more from board members? I have two questions. Chief, I wanted to ask you about the managing the masking thing you just mentioned. I would guess that the captains in a firehouse don't know the vaccination status of the people that are there, because that information probably isn't made available to them. I'm not sure. But how is it that they can enforce the need for masks on unvaccinated people when they don't actually have the information to be able to do that?
Francine, do you know what information we've shared with our supervisors?
So I don't believe, the captains have information on vaccination status unless the employees have shared that information, because it is protected HIPAA information. And employees only can be the ones to waive their their HIPAA rights and share it. So I don't believe the captain level has it. The battalion chiefs could, and I'm not sure if Dan knows if they do, or if it will be a self-reporting item regarding who needs to wear the mask. This is kind of all new. I haven't seen the policy yet, so I'm not sure I have the answer.
Well, I'm asking because we also are bound by OSHA to provide a safe workplace. And I don't think we can provide a safe workplace and comply with HIPAA. And I think, I mean, this is a very difficult situation. I lost the battle several months ago to have a mandate, but I'm very concerned about these things going through an entire firehouse, an entire shift, based on one person being exposed. And we saw what happened in the administration building, where a huge number of people, you know, and who knows if this came from one person or it may have come from a single person. And anyway, I think the problem is we're between a rock and a hard place. We have varying obligations and we're unable to perform our managerial duties without the information. But somehow I think we have to solve this problem. And I don't know what, you know, how we can do that, but I'm just urging you to have some sort of answer to it, because to say to OSHA, and we're talking about potential financial liability, if one of those firefighters died, I mean, we easily could have several $1 million obligation to the family about not having provided a safe workplace. And we need to do something about that.
So Director Bernstein, I'm going to offline, I'm going to tie back in with Francine tomorrow and talk about how we can manage that without violating HIPAA. I know in my last organization, we were able to still enforce some mask compliance without violations of HIPAA. So maybe it's something that HR can deal with and address it with individual employees to ensure compliance. But I completely understand your desire and have a similar desire for there to be a safe workplace.
Okay, thank you. And then I have a very trivial question, just because I always like to understand what I read. In the description of the fire in North Fair Oaks, it mentioned that it was a refuse fire. And I just wondered, does that mean somebody was burning refuse, or does that mean that a fire started in refuse?
Yeah, oftentimes like a dumpster, a commercial dumpster or something like that, or it could be some pallets up against the building, something like that will start outside of the building. When we say refuse, it could refer to trash or outside storage, something in the dumpster. And oftentimes if it's located adjacent to the building, flames will impinge on the building and cause it to spread.
And would we have investigated that to see if arson was involved?
I would imagine we would have. I don't have that information in front of me, but I'll find out and get back to you.
Okay, thank you. Any other questions on the chief's report? Okay, so we're going to move to the consent calendar to approve items 3, 4, and 5. Can I have a motion to approve the consent calendar?
I'll move.
Chuck, I'd like to pull an item off.
And I would too, but let me get the motion first and then we'll go ahead, Virginia.
I make the motion to approve the consent calendar.
Okay, and do I have a second? I'll second it. Jim, go ahead. What did you want to pull off?
Item 4.
Okay. Is that the minutes?
No,
no, it's the treasurer's report.
Oh, okay.
I just have a question.
And I'm going to pull off number 3 because I had a very minor change. I should have done it earlier, but I'm going to pull off number 3. So does anybody else want to pull anything? Okay. And is there any comment from the public on the one item that we are, the number 5? Any comment on item number 5?
Any member of the public has a comment on item number 5, please raise your hand or press star 9 if you called in.
Okay,
And
will
I
you
see
call
none.
the roll call then, please, Michelle?
Director Jones? Director Jones, you're on mute.
Aye.
Thank you. Director Crawley?
Aye.
Director McLaughlin?
Aye.
Director Solano?
Aye.
Director Bernstein?
Aye. Okay, let's go to item number 3 then. And I apologize, it's very picayune, but there's kind of a broken sentence. These are the minutes of October 7th. It's page 2 of those minutes, or page 20 of our board report. In the paragraph just above adjournment, Michelle, I'm asking if you could eliminate the word in the first line, the word when. Just eliminate it, and then the word that, and replace that with a because.
Sure, I can do that. I just wanted you to know that I put that in there because you said you made the statement at the time that you voted and not afterwards. So it was when you voted no, you said, I'm voting no. And this was before everybody else voted. I'm voting no because I want the board to know, you wanted the board to know that it would increase district expenditures, but that's fine. So
well,
I removed
I'm not changing the substance of what's said.
Okay.
It's just, I probably wasn't very articulate when I said it verbally, and reading it in print. I just wanted to read a little more smoothly.
No problem.
That's the only thing I had on number 3. Maybe we can dispense with these in a single motion. Jim, why don't you talk about number 4?
I just have a question about one of the items in the check register. It was on page 41 of the package dated November 3rd, 2021. It shows a Bay Area Air Quality Management District notice of violation, charge of $5,000. I just had a question: were we fined by AQMD, and if we were, what was the violation?
Good evening, directors. We'll have to look into the specific of the invoice or the check that you requested. I noted it, and I'll get back to you once I find out.
Okay, yeah, please. I like to, what
yes.
Was there a violation, and
Sure.
Is that a fine? And as whatever, if it was a fine, has it been corrected?
Got it.
Just out of curiosity, Lamb, who would approve such a expenditure?
So if that belongs to different program managers that handles I believe facilities, it would handle that air quality. What we have to take a look at it to see what program is in charge of that.
Okay.
Thank you.
Jim, would you like to make a motion then to accept items 3 and 4?
I'll make a motion to accept items 3 and 4.
And I'll second it as well. Any further discussion on this? And does anybody from the public want to comment on either item 3 or 4 or both?
And you can do so by engaging the raise hand feature or press star 9 on your phone. I see none.
Okay, a roll call vote, please.
Director Jones?
Aye.
Director Crawley?
Aye.
Director McLaughlin?
Aye.
Director Solano?
Aye.
Director Bernstein?
Aye. Okay, we're moving to item number 6, which is a report on our inspections. Is it the chief or John Johnston, or who's here to speak to that?
I am here. Sorry, my internet connection seems to be a little unstable, so I apologize.
We're not able to hear you, John. You're frozen right
Apologize
now.
for that. To go on to item number, are you able to hear me okay?
I think we skipped number 5, did we?
No, we'd approved that earlier, Robert. That was on the consent calendar vote.
Okay. All right, I'm sorry, I made a mistake looking at something different.
John, if you wouldn't mind, would you start over? You froze up as you were starting, and so we couldn't really hear you.
Yeah, I apologize. Sorry, my internet connection seems to be a little unstable. But before you is the State Fire Marshal mandated inspections for 2021. And we are required to do this from Senate Bill 1205. And for 2021, we had verified a total of 859 state mandated inspections. 858 were inspected. One of them was not due to health reasons at the end of the year. However, we have completed that at this time. And then the Fire Prevention Office also completed an additional 452 inspections that are not required by the state. So we had a 99.8% acceptance rate for completion. And so before you is a resolution to accept that as we are reported to the body as required by the Senate bill. Any questions?
Directors have any questions about the inspections?
No, I'd just like to make a comment. John, thank you so much to you and your team for the excellent record that you have. I know many departments don't achieve the high percentage that you do, and I know that's a result of the hard work of you and your team. So thank you so much.
Thank you. Appreciate the support.
I have a question.
Go ahead, Virginia, please.
John, I heard from one of my neighbors in this unincorporated area of West Menlo that one of the houses that's, I guess, unoccupied might be a fire hazard. I mean, is that something that y'all would even look at? I mean, not necessarily part of this report, but is that, well, something for a future report that y'all would look at? Or, how do we allay those concerns that residents have, especially in these, when these houses are being bought and sold and pretty much not maintained in terms of their yard?
Sure, if it's
neighbors are concerned.
Sure, if it's a single family home, it is not part of the state mandated inspections. So that would not be part of this. If somebody has concerns, they can always contact our office and we will go out to see if it is a code enforcement issue that we can work with. And we work very closely with all of our government entities and their code enforcement offices, and we'll make sure that it gets addressed if it's applicable.
Okay, I'll give you that address offline, John.
Yeah, just have the resident just send an email or phone call.
Okay, well, I told him I would do that, so I'll just send it to you.
Sounds good.
Thank you.
Do we have other questions on the inspections? I have one, John, and I also want to say I think you've done a great job at being very thorough and getting this done and so forth. But just the sort of one little exception makes me ask the question: what does somebody have the right to not allow you into their premises?
Yes, we have to ask permission, and then upon permission, then we can go do the inspection. So based upon that, if we have to do any issues, then we would have to go and pursue getting a warrant. We've never had that issue. It's just a matter of timing based upon the occupancy. And again, due to COVID, in this case, we had a change of personnel that was eligible to do the inspection. And then they ended up having health issues at the end of the year. So we just, for 2 months, were not able to get into the property to do the inspection. So
I see. But let me ask you, if there was something that was really egregious, and you suspected that they weren't in compliance, or there were things stored there that shouldn't be there, you don't have the right then to just walk in. You would need a warrant to do that. Is that correct?
I would need, if it's visible from the street, then I do have the ability. to do that. If it's visible, if it's something that would be behind closed doors, then that is something that I would have to look into validating the complaint and then getting a warrant to be able to get into the property to assess it.
And let me go one more step, because what if it were a situation like the ghost ship fire, and there was a industrial building where a party was going on, and it was clear they didn't have sprinklers, they didn't have exits marked, and so forth. Could you take action if an event were occurring at such a place?
Yes, if an event is occurring and the public is now entering that premise, then yes, we do have the ability to go in with law enforcement and provide whatever action is necessary for the safety of the public.
And that's what you do. You'd get law enforcement presence just for your own safety and so forth.
Correct.
Okay. Thank you very much.
You're welcome.
And what do we need to do, John? Excuse me. Do we need to accept this, or how do we acknowledge that?
There's a resolution. You just need to make a motion to approve the resolution.
Right. Can I get a motion to approve to approve the resolution?
So moved.
Second.
Second.
I'm sorry, who seconded?
I did.
Oh, Jim. Okay. Jim seconded. Any more comments from the public, from the board? I'll go to the public then. Would anybody from the public like to speak on this matter?
And if so, please raise your hand or press *9 on your telephone. See none.
Okay, roll call vote, Michelle?
Director Jones?
Aye.
Director Crawley?
Aye.
Director McLaughlin?
Aye.
Director Solano?
Aye.
Director Bernstein?
Aye. Again, thank you.
Thank you.
Okay, item number 7 is to adopt a resolution approving the master pay schedule for all district employees. And Francine, I believe this is your report.
Yes, it is my report. Good evening, directors. I would like to ask that the Board of Directors approve a resolution, or adopt a resolution rather, approving the master pay scale for all district employees. This is a required action it's required by the Public Employees Retirement Law, California Government Code 20636 for CalPERS retirement purposes. For calculating earnings that are subject to retirement. They require that the pay schedule be approved by the governing body in a regular open session. So I'm asking that the board approve the pay schedule. I've listed in the staff report some of the updates that were made. This master pay schedule is effective January 1, 2022. And I'll just briefly list the updates that are included. These are all by either resolution or approved MOU. We have a 1.5% salary adjustment for IAFF employees for their current MOU, a 3% salary adjustment for AFSCME employees for their current MOU, a 3% salary adjustment for chief officers per the salary and benefit reso adopted by the board on December 21st, 2021, a 3% salary adjustment for management and confidential unrepresented personnel for the salary and benefit reso adopted by the board on December 21, 2021. A new step 5 for the engineer classification that will be 5% above step 4, and that was in the IAFF MOU contract. A new step 1 for fire captain that is 5% above the new step 5 for engineer, again, an MOU approved item. Increasing the bottom of the range for the district assistant hourly and intern class titles from 1525 to 1575. And that's in accordance with the City of Menlo Park Local Minimum Wage Ordinance number 1058. The next one is increasing the top of the range by multiplying the maximum range by 0.00029, which is 29 10,000ths. For the following classifications, which is Senior Human Resources Analyst and Senior Management Analyst Exempt. to support the the compensation plan salary structure, which provides currently for a 50% spread from the top of the range to the bottom of the range. These two classifications somehow shifted off of the 50% spread. And so this is just cleaning up that salary structure. The correction is to the range, but not to any employees. These are two classifications. One is vacant. The other one has an incumbent, but the incumbent salary will not be adjusted as a result of this range adjustment. And lastly, the fire chief's salary for his contract and effective with his hire date, which is February 7th, 2022. So I'm open for any questions if anyone has questions.
I just wanted to clarify, there is a resolution to accept the
a resolution
after pay schedule. Thank you.
Board members have any questions? I'll just comment, Francine, thank you for bringing this back to the board, giving the board a chance to review the changes and doing it in the way that you have. We've corrected a very minor mistake that was in here, and I think that this is the appropriate way to do it, and I appreciate the work you've done to explain this to everybody.
Thank you.
Let me open up to the public if there are any public comment on this item.
And if so, you can raise your hand or press *9 on your phone. I see none.
Okay, no further comment, then let's, I don't think we have a motion yet. Could I get a motion? We don't have a motion, right?
We don't have a motion.
Chuck, I'll move to approve the master pay schedule for all district employees.
Thank you. And a second?
I'll second.
Okay, I've got her Jim first. And a roll call vote, please.
Yes, and Director Crawley, you said to approve the master pay schedule for all district employees. It's just to clarify again, it's a resolution, so I'll move forward.
Yes, I'll approve to adopt the resolution approving. Thank you.
Thank you. Director Jones?
Aye.
Director Crawley?
Aye.
Director McLaughlin?
Aye.
Director Solano?
Aye.
Director Bernstein?
Aye. Okay, thank you. We'll move to item number 8, which is to approve a resolution, to adopt a resolution approving the 2022 Flexible Benefit Plan Amendment and Restatement. Francine, could you present this one too, please?
Yes, this one is mine as well. This one is, so basically the Flexible Benefit Plan includes the benefits that are eligible for purchase with the district's cafeteria monies. And during the open enrollment period, so last quarter of 2021, I conducted a survey and asked employees, I think it was 9 questions, to get some feedback regarding the open enrollment process, how they like information to be received, what they thought about the district benefit package, if there's any benefits that they were interested in. And I was actually quite surprised by the response. I felt like I got a good response. Over 40% of the district, 137 at the time, active employees responded to this survey. I kept it open for just under a month, just to kind of get as much feedback as I could. One of the questions that I asked in the survey was if there was any interest in voluntary employee paid benefits, and if so, what type of benefit would employees be interested in? And this question had the majority of participants, 61.8%, preferred a vision benefit over other ancillary benefit plans. So then I started talking. Hello? Oh, sorry. I thought I heard some echo. What I would like to do today is ask that the board approve a amendment to our flexible benefit plan to allow district employees to use flex credit monies to purchase vision insurance. If employees don't have any leftover flex credit monies, this would be an employee paid benefit. This resolution would not change the amount that the board agreed to provide to employees under the MOUs or the compensation plans. It just allows another benefit option under the flexible benefit plan. So it would be a cost neutral vision benefit plan. The vendor that I've been working with, kind of looking at the cost and the benefit that's available is VSP, which is a well-known vision plan. And if the board approves it, we would do an open enrollment period and have the benefit effective April 1 of this year. I'm open for any questions if anyone has any questions.
Board have any questions? Francine, I have two. One, I was going to ask if, would you be able to offer our medical plans through this same flexible benefit plan?
They are.
They are?
Yes.
And so if people wanted a more expensive benefit plan, they can use this allowance to pay for that additional amount. Is that right?
So there's a couple things. They could subject to the language in their MOU, and in certain groups, employees are limited. Their cafeteria contributions are based on their enrollment coverage. So in some groups like IAFF, they get each employee gets a certain flat amount regardless of enrollment level. So regardless if they're an employee only, employee plus one, or family. For the other groups, AFSCME, the chief officers and the unwrapped management confidential, those groups, currently the language is that they follow based on enrollment level, how much you're eligible for. If that language was updated, then employees could use up to the full amount through the flex benefit to purchase the more expensive single party plan. We would just need to update the language in the MOU and the compensation plan that currently restricts it based on enrollment level.
Well, I'm asking because it seemed like there was one group of employee that we never could make whole in terms of some things that had once been promised. And suddenly, as I read this, it seemed like we could have used this mechanism to make them whole.
So we can use the flexible benefit plan. I don't know that it'll make them whole for the benefits, the cash benefits, that were paid, but we definitely can allow them to use the flex credit monies for, if the board wanted to not assign it to tiers, we do the flat amount for everyone, and that definitely can be an option. And it would run through the flex benefit plan. We would just have to modify the compensation plan language.
So my second question kind of relates, and this isn't the place to discuss it. I'm supporting what you're proposing here, but it seems to me there's really no benefit, there's no reason for us to limit what we could put as possible offerings into here. In other words, we could offer chiropractic for people who wanted it, or we could offer long-term care insurance for people who wanted that. That as long as we've sort of offered employees these dollars, there's no reason to pick the number one benefit. I mean, we could put in 5 or 10 benefits in there.
Yeah, so I'm kind of taking it as a step approach, and I will continue to look for other eligible benefits that can go through our flex benefit plan. It takes time. So after doing the survey, this was the number one. So I thought I would bring this forward, and then I can research other benefits that are of interest to see which ones we can add to the flexible benefit plan.
Okay, and then I noticed, I was reading, we don't need to go to the section or anything, but I did notice the change in the plan to be an April 1 enrollment rather than a January 1. but next year you would change that back to January, I assume.
Right. It would fall, yeah. So basically April 1 would be the effective date because we're doing a mid-year. We're adding this benefit mid-year, but we will follow to our normal open enrollment schedule come the end of this year.
Okay, and then there's no prohibition to having a mid-year open enrollment when you've added a new benefit.
No, as long as it's covered under the flexible benefit plan, which is why I'm bringing it forward to the board, because we would like to restate the plan so that it includes this benefit so we can offer it to employees.
And do I assume correctly that the mechanism here is a Section 125 plan? Is that what the public sector employees use?
That's correct.
Okay. Okay. Thank you. That answers my questions. Anybody else? Any further questions? I'd like to open this then to the public for any comment from the public on this item.
You could press *9 on your phone if you called in, or you could use the raise hand feature. I see none.
Okay, and Virginia, you've made the motion, Jim seconded it, so we can move right to the roll call vote here.
That was for the master pay schedule. I don't have a note.
I'll make the motion to adopt the.
I'm sorry, I thought you had already made it. I'm losing.
No, that was for the last one, but I can make a motion to adopt the resolution approving the 2022 flexible benefit plan amendment and restatement to include a cost neutral vision benefit plan effective April 1st, 2022.
Okay, and a second, please.
I'll second.
Okay, Rob seconded. Go ahead with the roll call, please, Michelle.
Director Jones.
Aye.
Director Crowley.
Aye.
Director McLaughlin.
Aye.
Director Solano.
Aye.
Director Bernstein.
Aye.
Thank you so much.
Motion carries unanimously.
Thank you. Thanks, Francine, for all of your work on this and the other one.
Thank you. Yes, very good work.
Okay. We have item number 9, which is a discussion item only, and there's no staff report on it. But I'll ask the chief if he has anything to say about it. He may not even be aware of what the issues are. But we have, we were going to discuss the ambulance situation that we have with the county. I don't know if there's an update from the chief or if there's someone else that wants to give an update, but I know some board members wanted to speak about this.
Yeah, Director Bernstein and members of the board, I kind of addressed it a little bit during the COVID update that currently we are not having the same challenges that we were initially with the ambulances, with the BLS ambulances and using our paramedics to upgrade them to ALS. I'm pretty well aware of the situations here that are occurring throughout California, as AMR and Falk and the other private providers are challenged with staffing, much like many fire agencies are. But with that, I will turn it back over to you for the conversation.
Okay. Would anybody like to address this? I know you had some thoughts and you looked into it, Virginia, or Jim, anybody?
I'll make some comment. I mean, I think that the chief is right, but I do think it's something that we need to monitor, number one. Number two, and I guess I could probably do this in the latter part of our director's comments, but I think also this might be the appropriate time to just say that the JPA committee that I have been appointed as liaison to, we have quarterly meetings. That first meeting in January was canceled. For whatever reason, I don't even know. So the next meeting will be in April. So I am hoping that we'll be able to, get a better understanding of what's going on, since 25% of the meetings have been canceled for this year. And I'll give a report to the board if I have any additional information from that meeting, if it's not canceled. But I am disappointed that the first meeting was canceled.
Okay. Does anybody else have any comment on this? Or
Chuck, I would just ask the chief, is there a mechanism to capture good data on this issue, you know, when we're having to supplement AMR resources?
That's a good question. I know Melanie has been tracking it. I don't know what our data or metrics look like. I don't know, Chief Coyle, if you have any information on that as far as what we're actually tracking, but I can certainly get back to the board with that if we don't have the answer tonight.
I can make two very quick comments, Director McLaughlin. We were attempting a two-pronged approach at collecting the data automatically, one of which was our own staff digging into the CAD data. That proved to be time and labor intensive and kind of prohibitive because of that. It was just the volume of data was so astronomical. Our colleagues at Dispatch also attempted to generate regular reports, so basically monthly reports. And I spoke with Lisa, the director there this morning. She said they encountered some unanticipated challenges, but I can tell you that kind of going back to the old stone tablet and chisel is working. And we have had 0 BLS ambulances used in Menlo Park for 911 calls since your last board of directors meeting. And so we are tracking that basically. We've instructed all the fire officers and paramedics to email myself and Melanie anytime they get a BLS ambulance, and that has not happened since last board meeting. So unfortunately, we're not getting the data automatically, but it is fairly easy to track because it is at this point very rare.
Well, thank you.
Don't we know internally though when a paramedic is required to accompany a patient to the hospital, we would have some sort of internal report or record of that, wouldn't we?
We do. We keep track of that, not necessarily, at least the initial intent for that was not to track them using our medics on BLS ambulances, but rather to track how many times we send our paramedic as an enhanced level of patient care due to a complex medical emergency such as childbirth, major trauma, cardiac arrest, that type of thing, where an extra set of paramedic hands is sent simply for a greater level of service for the patient. And we do track that in our Firehouse. We call it Firehouse. It's our National Fire Incident Reporting System software. We do have a click box there for the captain anytime that we send fire personnel with a transporting unit.
And could you just enlighten us on the process of that? When you do that, how does the person get back to the station house when the event is done?
For us, we're lucky because we have hospitals so close by. The fire company, either the rescue engine or truck, will go to that hospital and collect their personnel.
And so that, I mean, I'm not suggesting that we shouldn't help people in our district who need help, but it actually takes an entire unit out of service. And how long do we have to wait at the hospital? Do we have to wait until that person gets into the emergency room, or is that a long process?
No, it's typically drive time. So the fire company will pick up their medical gear at the call, decon some stuff if they need to, and then drive to the hospital. Again, we're very lucky to have the hospitals within just a few minutes. Half Moon Bay coastside fire, for those folks, it can be an hour turnaround. For us, it's on average 10 minutes to get to the hospital, and the fire member is usually waiting outside on the curb for the engine to pick them up. Once we get to the hospital, if the patient hasn't been handed to the hospital staff, the ambulance can't leave, but our member has done their job getting the patient to the ER with that higher level of care with double paramedics.
Thank you. Well, that was a rather short discussion. If nobody has anything more to say about it, I can say that I was troubled by a couple things on this. One is I was troubled that AMR was not complying with its contractual requirements and using very lame excuses like a non-strike excuse for not being able to comply. And but they had the gall, in my opinion, to charge people the full ALS rates for using one of our personnel on their ambulance. And somehow that's not right. Now, maybe they've cleaned up their act permanently, or maybe they know they need to let things cool off and go back to business. And even though people are saying it's hard to get paramedics, I was proud of our agency. I don't remember the exact number. What we have, maybe 9 new people or something, but of those, over half of them were paramedics. So I thought we were doing quite well in terms of recruiting paramedics, which suggests to me that it's not so hard to find them. It's just that you need to pay them once you find them, and that AMR apparently wasn't willing to pay them. So I think, yeah.
Yeah, continue. I was just.
No, please, Rob, go ahead. I'm done.
No, just probably the largest thing that really bothers me is that AMR has the national contract with Department of Homeland Security and FEMA, where if there's any type of disaster within the United States, they're the major supplier of ambulances. And, that includes hurricanes and earthquakes and, whatever. And for them to be the major response or backup for ambulance services for the entire country through DHS, how is that going to affect us if there is a disaster somewhere else in the country? So that's probably one of my major concerns. Thank you, Chuck.
I'd like to follow that up with a question. Maybe the chief or the deputy chief know. Does AMR have the right to conscript our paramedics in case of an emergency?
I don't know the answer to that. Chief Coyle, to you.
I'm not super comfortable saying yes or no on that. There are agreements in the county where we will help them out locally. I don't know that they have any right or ability to take our paramedics and put us to work elsewhere, if that was the question. I could, though, and Chief Lorenzen is far more experienced in these matters than I, but I could see if there was a large disaster or if AMR was at any point unable to fulfill their public safety role, that the fire medics may be pressed into service to staff the ambulances. And I think that we would actually be quite successful if that ever came across our plate.
I see. Well, it certainly seems to me that there's a possibility that such an event could occur. There's no reason to think we won't have an earthquake. And it'd be nice to know to what extent we have control over our own personnel. I'm not talking about additional people called in or something of that sort. I'm talking about being able to staff the units that we have. But so we ought to at least be aware of what the limitations of the contract are on us. Any other questions or comments on this matter?
Chuck, I have my hand raised.
Oh, I'm sorry. I only can see 5 people at a time. There you go. I see. Go ahead.
Well, so I have the same concerns that you have, and I just didn't bring them up because I think I've brought them up before at a previous meeting. But I am concerned about the possibility that AMR has breached the contract with the county, but I don't know for sure, and I'm not an attorney. Is there any way that we can get an update from maybe from the county or from somebody, since the JPA meeting has been canceled and we have not been given any updates at the beginning of the year when we probably needed it the most? And I'm not the only one who's concerned about this, by the way. There are other people on this committee that's liaisons with their respective cities who are also concerned. So I don't know, Mark, if this is something, or Dan, that we should get an update on, since this has been a concern, at least for me, since 2019.
Director Croy, I will reach out to our LEMSA and also work with our staff and have an update available for you at our next board meeting on just that.
Thank you. I mean, I honestly think that the public is entitled to know as well, since, I mean, I think things it sounds like may have been stabilized, but I don't know if there's been a permanent solution, or, if there are alternatives that we can look at. But certainly if ambulance service is being affected, the public has the right to know. And maybe it's less so now, but the fact that it has been swept under the carpet is very troubling to me until now.
And let me ask you a question to our general counsel, Stephen. Virginia's asking about breaching the contract. I mean, I would guess that if they don't meet their contractual obligations, that is a breach. But the question is, how serious is it, and does it rise to the level that we could take action on it?
Yeah. So, Director Bernstein, it's a good question. I think I need to do some research of my own just to understand the contractual landscape of who is in contract with whom, such that a failure by an ambulance company implicates which contract between which parties. So like Chief Lorenzen, I will confer and get a better understanding of those contracts so that we can answer your question.
Can I just mention, I think there would be one further point to it, just to protect ourselves. And in the event that an ambulance was not available, what are our rights to do something to resolve that situation? And I don't know where state law and I just don't know what the limitations on our action. And if we took action, are we jeopardizing ourselves in terms of liability or something? But I think we at least ought to be prepared to know what we would do in the event we had to take an informal action, like transporting a patient in a battalion chief car or something of that sort. Would we be violating the law? Would it subject that person to serious liability in some ways, and so forth? So, okay, any other?
Can I make one more comment? Because I am concerned about the issue that Rob keeps bringing up, and it's not the first time that he's brought up that. What is it, Rob, about how AMR is the national ambulance provider or emergency transport provider for FEMA? Is that correct, or something along those lines?
That's what I heard.
Yeah, no, I think you're right. And I mean, and that's the other thing. It's, kind of like a government sanctioned monopoly right now, and of a private ambulance company. And so, I want to be able to look at different alternatives if we have to.
They're also sole proprietorships. They're not traded on any exchange either.
Yeah, they're a private company, but not a publicly traded company, is what you're saying, right? Yeah, I gathered that as well. Thanks, Chuck. Thanks so much, Mark and Dan.
Director Bernstein, I will also check into that question on our liability if we were to transport in one of our own vehicles in case of emergency, and also report back.
Well, I mean, Mark, I think the bigger question is if we didn't have a choice but to do that, right? I mean, we're basically meeting our responsibilities, in the public safety realm, but at the same time, what are the liabilities if there isn't an ambulance available?
Right, and my guess is that our firefighters would do what was in the best interest of the patient and worry about,
as they should,
later. And but what I will do is find out what those might be, so we at least have that awareness.
Thank you.
Well, yeah, I'm just saying that I think they might too, but on the other hand, I could see somebody hesitating for 5 or 10 minutes and making a telephone call to find out what they should do, and that might not be in the best interest of the patient. So it would be better if we knew in advance what we would do. Sure. Okay, great. Any other last comments? Then we'll move to item number 10, which is a kind of a discussion of how we would like to proceed in terms of reviewing the constant report and reviewing emergency management and community preparedness efforts in the district. I made a suggestion of that we put some things out to some different committees, but there's no specific reason we should do what I'm saying. I was just trying to find an orderly process for dealing with the issues here. I was basically recommending that the Strategic Planning Committee take a look at 2 of these issues. One of them is, how do we provide or how do we support volunteers who are potentially providing a disaster preparedness services in the event of a disaster? And secondly, what do we do in the area of dealing with professionals that are and serving as the catalyst for our constituent agencies, the 3 cities and the county, in terms of their preparedness efforts. And we've been trying for 10 years now, I think, to do some coordination or somehow provide some support. And yet we seem to have not made really any progress with them. It's not statutorily, it's not our responsibility to do those things. And it's not clear to me that we can have much influence on these agencies. So those are 2 issues that I thought it would be helpful to have the Strategic Planning Committee take a look at. And in terms of the contract itself, the report itself, I was hoping that we could discuss that perhaps at the Finance Committee with an idea, you know, did the report do what we needed it to do, and how was it conducted and so forth. So those were my thoughts, but I don't feel strongly about any of them. I just wanted to find an orderly process here. Let me open it to the board for your comments and discussion.
Chuck?
Yes, go ahead, Robert.
I don't know how to say this without offending you or the process, but I'm a little taken back by the memo. I'm shocked and surprised that it's out now. You appointed myself and Virginia to the E-Prep committee, and this report falls within that. And we did meet, we did talk about it, and I did have a report to give to the board when it was appropriate. The thing that's going to, you and anybody else going to have to come to grips with is that if you establish a process of how things are to be conducted on the board, that to me, it seems like that you should honor that particular process. If it's going to change, then I think the board need to kind of come to grips with what that change is going to look like. So that, I mean, the committees, if things like this will come up, and it just happened to be the E-Prep committee, and it could be any committee, that when you assign certain tasks to a committee, to at least allow the committee to respond back before a memo that you put together and sent out to the board would come into play. To me, I feel like the committee is now being hijacked at this point in time. I hate to use these kind of words, but it just feels that way. I understand what you have put together here, but it's similar to the kind of things that we had talked about in the E-Prep committee. And so, like you say, I mean, how did, the prerogative of putting this item on the agenda, did I miss the meeting? Was it something that was decided at our last meeting that it was going to happen? I thought at the last meeting it was assigned to the E-Prep committee members, and they would look at it and then bring some information back to the board. So if that process is not going to happen, going to work anymore, with the E-Prep committee, I'm hoping it's not just our committee or any of the committee, then I think we really need to seriously look at how we conduct our business amongst ourselves as board members.
Let me ask you a question, Robert, to follow up on that. Mm-hmm. You said you were preparing a report and so forth. Do you want to make that report now, or are you going to make it at your committee report time at the end of the meeting?
I was going to make it at the committee time for committee reports based upon what we have done in the past. Committee makes a report, and any items that come out of that out of the report, if there are recommendations to be made to the board, then the item would be agendized at the next board meeting. And so that was the anticipation of what to occur. But now it seems like item number 10 is before us, and you are expecting certain things to happen. So I'm just kind of wondering, what's the value of the committee meeting and talking if at some point at will that the committee itself can be hijacked on what is an intent to be had. And I'm not, please don't take it wrong. It's just, I'm just saying, I don't know how the item got on the agenda. It didn't come through the board that I know of in any formal sense. Maybe it did, but it, you know, I thought it was just one of those, it goes through the committee makes its recommendation, talk to the board, and then anything from that gets in, if it go back to the committee or as the board move on in other directions, then that would take place. You know, to me, you know, to present something and then come back and try to deal with your list here, I'm a little conflicted now at this point, so I need some help.
Well, let me just to clarify that I did want to just discuss the process. In other words, I was not expecting that we would take an action or do anything during this item. I wanted us to have a process, and I know your committee did discuss it at your last meeting and so forth. And I thought you might be making a report about what you had discussed and so forth. And you certainly can do that. But I mean, I think that there's a lot of pressure, you know, to actually get to the substance of these things at some point. And I was just trying to have us have a process of how to do it. So I too am interested in the process. And it seemed it was possible that these issues affected more than just emergency preparedness. They had affected other things as well. So, but anyway, I hear your comment here. Do we have other comments from the board about the appropriate process to take with this item?
Chuck?
Yeah, go ahead, Jim.
You know, I don't know if this is really so much the, you know, the process as you've outlined it here in the memo, but at the, you know, when this report was presented at the meeting last month, I know I took real exception to the report. In fact, I think at the time I suggested that the board distance itself from it, you know, because of its factual inaccuracies and just overall inadequacy in addressing the issues of concern to the board. So whatever, you know, whether we do it now or later during committee reports, you know, I would like to address that. You know, what process, when we, you know, we commissioned, the board commissioned this report, you know, I found it to be inadequate, and I don't know how the other my other four colleagues feel, but you know, I'd like to outline a process that you know, creates a way to memorialize those exceptions and either reject this report or not accept it. Well, I say whether that happens now or whether we discuss it now or discuss it during the committee reports. Those are my thoughts on the subject.
Let me ask you, Jim, do you think there's some urgency to, if you wanted to reject this, do you think there's an urgency to rejecting it?
No, I mean, and I don't know that we have a formal process here. I mean, in my mind, the board has not accepted or adopted this report. You know, that it's still considered, again, in my mind, it's still a draft document until the board formally adopts it. So in that sense, I don't have a sense of urgency, whether that happens tonight or sometime in the future, because I don't think it's considered an adopted official authorized report until we formally accept it. So again, whether that happens tonight or sometime in the future, I don't have a sense of urgency.
Okay.
I think the important thing is to look at, and I know that everybody have read the document. I assume it's not, it's pretty, there's a lot there. But if you have not looked at it, I think you got to compare between what the document, what the information is in the document and what the metrics was and is for putting a document or begin to proceed down the road of putting a document like this together. And then there's a third element to it, as far as I'm concerned, is that the initial impetus for even this study 2 years ago or so, or maybe a year ago, to contracting out a consultant to do something to solve a problem or look at a particular problem, to begin to take that information and begin to tear it down and to see if it solved that particular problem. If it did not, then understanding what it is, where the gaps are, and where we need to fill those gaps. Because we asked, oh, well, they didn't do it, then we hire somebody else to do it. Well, what are we going to hire them to do? I don't think we really had gotten peeled the onion away to understand that in a thorough manner. So the goal for this, we talked about this, to trying to get history and then try to understand where the shortfalls are in meeting those goals. So I think, throwing the baby out with the bathwater, we can do that, but I think we need to understand what we have first before we actually throw it out and say, let's start over again. And if we throw it out and start over again, what is it we're going to be asking the next group to come in and solve? So that's where the clarity comes into play. And that's why you outline a process, but I think in fairness to the committee, I think you should at least hear from the committee before you start throwing the baby out with the bathwater and creating a different process.
Other directors' comments? So Robert, let me understand, you're going to make a report tonight as part of your committee report. And do you have a recommendation, say, for our next meeting to consider something, or can you give me an idea of kind of what you don't have to reveal the report, but I'm just trying to understand, are you going to suggest a process then for the next steps or what we do next?
Folks been around me for 4 or 5 years, it's all about process for me. And so I try to adhere to that particular philosophy and things that I do. And the committee has talked about it. And I had tried to capture that in a report to the board. And it's all about process, not about hearsay, not about feeling good about something. It's about trying to get to the understanding. But did this report really meet the goals and objectives that was outlined? I'm asking any of the board members, do you know what the goals and objectives were? I'm not clear on all of them, but I see the report and I understand what should be there. And I have to dig deeper to kind of understand those categories in which it said it addressed that. And did it address it adequately? I don't know. And that's part of digging deep and trying to understand. To bring back to the board our understanding, so now we can confer about whether it met board expectation, because there's 3 prongs to this. It's the board expectation, it's the community expectation, and it's also the E-PREP in itself, the expectation for the emergency preparedness, which has to do with the CERT and all that other activities that goes along. Because emergency preparedness is more than just CERT. You need to understand that. It's more than just the fire district. It has to do with the towns, the cities and towns that we engaged in. And there's a third element there is the county. So we got to understand all of that and how all of that, comes to play and coming up with something that's viable for the district.
Okay. Let me just say, by the way, I don't know how long your report is, but just as a future idea, and this is directed really to all committee chairs, it would help me to know prior to our agenda setting session, and the agenda setting session is roughly at the same time that the committees meet, but hopefully a little bit after, a day or two after the committees meet. It would help me to know if you had enough substance to have an agenda item on the full board agenda. So at the point at which you have something to report that will take a couple of minutes, or maybe have some slides or a guest speaker or whatever, please let me know so that we can schedule that for the board meeting. Because once we get to reports, it's not impossible that we could take action on something in the reports, but most of our action takes place in the middle of the meeting. So if there's something really major and really extensive, we'll make a spot for it on the agenda. Okay.
Wait,
Virginia,
Chuck.
Go ahead, Virginia.
I just want to elaborate on a little bit about what Robert said. It just, when I saw this item, it just felt like that the E-Prep committee was being bypassed for things that we were charged to look at. And I don't want to speak for Robert, but just based on, look at your proposed steps, right? You mentioned pretty much all of the committees in here that should be looking at it, except the E-Prep committee. And maybe I misinterpreted that, but I'm not sure that the board has asked for something from the E-Prep committee, and maybe tonight is the time to make that ask. And it sounds like you have, in terms of a report. I don't know if what Robert's report is for the Emergency Preparedness Committee, which he chairs, but I just want to make sure that I understand, based on item 10, that the E-Prep committee is still supposed to be looking at this, or what, because it makes it look, the report or the item makes it look like the E-Prep committee should not be looking at this anymore. That's my interpretation. I could be wrong, but that's my interpretation.
Well, I think we have one restriction that we have to be careful of, and the committee should look at different aspects of this. We shouldn't assign two identical aspects of an item to two different committees. I mean, the same aspect to two different committees, because that gets four people discussing an item outside of a regular board meeting, and we can't do that. So
right, but the E-Prep committee has looked at it comprehensively already. So that's what I'm trying to understand.
That's what I thought you were done with it, and that now there were some issues that would fall into another area's jurisdiction.
Oh, okay, then I misunderstood and misinterpreted your agenda item memo.
It's sort of like, if I may, it get back, and please don't take me wrong here, is that you just made it a statement that the I guess committee need to confer with you so that you can kind of, as you're doing your agenda setting, to be able to, I guess, coordinate what goes onto the agenda. With that said, as my dad used to say, "What's good for the goose is also good for the gander." And what that means is that as you decide you want to bring up items as it pertains to that committee, and then insert it onto agenda, it would be nice to know, as committee chair, or either as a membership, as a committee, that that's what your thoughts are, so that we can talk about it, and we at that point may be able to share with you what goes on. Now, if there's a reporting method that after every committee meeting that everyone has to talk to you about it, say that, so that we all the committees will know that. If not, then we will have this confusion month in and month out. And that's no productive way to operate a board such as this, and to put committees in an embarrassing moment, and put the board in an embarrassing moment, because it's not my intention to even talk about this, but I don't know what else to do because of the way it happened. I'm just saying, as it relates to one, it should relate to all of us.
Well, I think it's good to talk about it, so I'm glad you did. I hear what you're saying, and I understand it. There's relatively few agenda items where 4 or 5 people feel quite strongly about them. It rarely happens, but this happens to be one of them. So I'm prepared to kind of await your report at the end of the meeting at this time, and but I'm happy to hear comments from other directors if there are any more comments on this at this point. Hearing no other, again, I can't see everybody on my screen at one time, so be sure to speak up if I miss you. I do see Lynn Bramlett has a hand raised, and there may be other members of the public that want to speak to this item. Michelle, will you go ahead and recognize and do whatever's necessary to elevate people to the meeting? I didn't hear from Michelle.
I'm sorry, I was of course on mute.
Oh.
So let me say what I was trying to say. So the first thing is, if anybody has any public comment, please raise your hand, or you can press *9 on your phone. We do have one public comment, Lynn Bramlett, and she can now unmute herself. Lynn, if you want to unmute yourself, you can give your public comment.
Good evening, Good evening, directors. I'm Lynn Bramlett, actually in Utah right now on a trip, long-term resident of the city of Menlo Park. I'm also the leader of MPC Ready, a community-based organization focused on helping to build neighborhood-based disaster resiliency. However, tonight I'm speaking on my own behalf. I also welcome new Chief Mark Lorenzen to the Menlo Park Fire Protection District. I'm delighted to learn that you live in Menlo Park, and on behalf of MPC Ready, I invite you to speak to us at one of our upcoming community meetings, and I will follow up separately with you about that. I do want to thank the board for your diligence in authorizing an outside assessment and review of disaster management services in our area. I have serious concerns about the report and even the history and assumptions that I think need clarifying in a broader discussion that involved the jurisdictions. And one important point is that in 2012, the city of Menlo Park first heard the idea of outsourcing disaster management to the fire district. They heard a presentation as part of a broader study session from the then fire chief, along with a current employee of the fire district who was there. And the presentation was basically, Menlo Park used to have these services in-house, but they were told, in short, it'll be less expensive and it'll be better if you turn it over to us. And it's my belief as an actively engaged resident in Menlo Park, long before I took my current role with MPC Ready, they believe the fire district has it covered. And I see somewhat that same impression in East Palo Alto and also Atherton, although Menlo Park, especially parts of it, and East Palo Alto are significantly more at risk of a disaster that we know is coming, such as an eruption of the Hayward Fault. It's predicted, they've been warned, and yet we're no prepared now than we were when we first heard about it. So to me, it's time that we all come together. We're able to talk about our roles, what we're doing, what we're not doing, kind of have a fact finding. And to me, that report did not do that. It was not an assessment. And that's really what we need. We all want to work together. MPC Ready is certainly not trying to take the role of the first responders, et cetera. But I see inadequate involvement of the jurisdictions who I believe weren't even interviewed for this report. So I think we do need to look at the methodology. Could it even be replicated? There's no list of papers that they read, studies that they read, and a major finding and recommendation was based on a 2019 draft report that I could find no public record of a review. So we need a deeper conversation wherever that happens. I like the idea of a study session where we can also hear about national trends taking place for emergency management program. And I also urge a consideration of the financial risk to the park district. Should an assessment not be made regarding the potential for legal liability based on the situation. So again, I want to work with counterparts. I want to work with our district, but I think we need a better process than what I've seen so far. Thank you.
Thank you, Lynn. One thing that I didn't mention earlier is I also, and we can wait until we hear Robert's report, but I was hoping to schedule a study session of the whole board once we had gathered some information, but a study session that could involve input from the community as well. So we do need to do that. And one of my reasons for wanting to hurry this a little bit is one of the recommendations that was in the study was that we double the size of this OEM group. And that would be something that would be in the budget that would be coming before the board in March or April. So we don't have lots of time to study this matter before we're going to be hearing possibly some budget recommendations. So we can move on from there unless any last comments on this matter before we move to item number 11. Okay, let's move to item number 11 then, which is the mid-year fiscal review. I know Long Lamb prepared this, and but Chief, were you going to speak to it, or are you going to have Long do that?
I'm going to have Long speak to it.
Good evening, directors. I can speak to the staff reports. So this is the district's mid-year fiscal review staff reports for the fiscal year 2022. This report summarized the district's fiscal activities for the first 6 months of the fiscal year. Then we used the data from the mid-year point to forecast the projection for the full year. This staff reports will only focus on general funds, the capital improvement fund, capital improvement project funds, and the debt service funds for the fiscal year. So I'm just going to provide a summary, synopsis of all the major funds and an executive summary. And if there's any questions, I can dig into it further. So if you turn the page to page 143, where they provide the executive summary for the district's activities for the fiscal year. Our projections at the end of the fiscal year, we are projected to increase our fund balance by 10.3 million. We had a beginning fund balance of 70.8 million, and we're projected to end the fiscal year at 81.1 million. Then if you turn the page, or if you can follow along, if you turn to page 144, this chart on page 144 will provide the general funds activities for the fiscal year. As of December 31st, 2021, the district's total revenue that we've received so far, it totaled to be 38.9 million. Our total expenditures so far is 25.9 million. And the net transfer in, transfer out, total to be 2 million of transfer out. And our current unassigned or budget savings that we're projected to be is at 11 million currently as of December 31st. And if we were projecting it to the full year, our fiscal year 2022 total revenues for the fiscal year would total to be 71.9 million. our total projected expenditures will be 53.6 million. Our net transfer in and out will total to be 2 million. And our ending net projected unassigned budget savings for the fiscal year will total to be 16.3 million. So that is the summary of our general fund. I'm gonna move next to our capital improvement funds. And that's located on page 152 of the report of the package. So during the fiscal year, we had a beginning fund balance for our CIP funds of 28.6 million. We're projected to spend about 8.2 million, and the transfer in or revenues is 3 million. We're projected to have an ending fund balance at the end of the fiscal year at 23.4 million. So in fiscal year 22, we had various CIP projects that were approved and staff has been working on it. The major projects that are still ongoing in progress are the Station 4 rebuild, Station 1 fencing, Station 3 accessory buildings, Station 77 room additions and a mechanic shop extension, and the special operation warehouse automatic gate. So in this fiscal year, 2022, staff is anticipating that Station 1, the Station 1 fencing project and the warehouse automatic gate project will be completed. As far as the remaining projects, it will be rolled over to the fiscal year 2023 in terms of the completion dates. Lastly, for the debt service fund, on page 153 of the package. So our debt service fund as of December 2021, we closed our debt service fund, but we had lingering activities during the year. So, but just to go over, we had a beginning fund balance at the beginning of fiscal year 22 of 107,000. Then we receive our IRS subsidy credits for 178,000. That totals to be 285,000. And the entirety of the amount was transferred out from the debt service fund to the general fund in December. And the debt service fund has been closed as of December. I'm available for any questions if there are any.
Okay. Are there any questions? I mean, this is good news. You know, we're projected to have a $16.3 million surplus here, but I just have to remind people that we are not budgeting for our capital needs yet. It's something that I've been encouraging for a long time. I'm hoping we can finally get to work on doing that. And I think once we budgeted and reserved for our capital needs, which are probably in the neighborhood of $60 to $100 million, we're not going to have a surplus anymore because those monies are targeted for things that we're planning to do. So we just haven't reflected that in our financials, and I think we need to. So Robert, you have your hand up. If you'd like to go ahead.
Yeah, along the lines of what you just got to talking about, Chuck, in terms of looking at a long-term capital needs and trying to figure out a way to how to fund that. One of the things that seemed like it doesn't appear that we have. I haven't seen it. If you have, yeah, I know we had consultants a couple of years ago come in and lay out the options for us in terms of development of the projects, but we really didn't get a clear time frame as to when those projects are expected to come online. I think there was some mention about how long it may take each one of them to get built, But corresponding to that, I haven't seen where the board actually started looking at how are we going to finance, and to have, you know, 16 million kind of laying around, you know, kind of, we can congratulate ourselves on that. But I think somewhere we need to kind of start figuring out how to utilize that capital, the surplus, as well as how we're going to finance the rest of it. So it appears to me that the Finance Committee, along with possibly the Strategic Planning Committee, in terms of looking at the timing on all this, so the finance and the timing can kind of come together with some level of expectation and assurity that it's going to happen in the time frame that we want.
Okay, thank you. Jim, you have your hand up.
You know, along those same lines, I know that for a number of years now, we've paid down our CalPERS liability. So what is the process this year in light of, you know, these unallocated funds? How will we determine how much we contribute to paying down that CalPERS liability? What's the process?
So if you, it is noted on the report as well. We usually on a yearly basis, we budget for the payment, the excess payment to CalPERS during the fiscal year. And if you look at page 144, in the middle of the page, we did allocate 4.8 million, close to 4.8 millions that we're gonna pay on top of our annual UAL payments. So we have budgeted 4.8 millions to go out this year for that purpose.
And how did you arrive at that number?
So on a yearly basis, we budgeted more. Let's say our CalPERS rate is at 25%, let's say. But we on our budget, we budget for 41% for the safety class 6. So the difference of that gets rolled into the excess payments. That's how we've been doing it in the past.
Okay, thank you.
Jim, let me add an explanation also. This was a point of contention in the Finance Committee for several years. The board long ago, even before I was on the board, so maybe 9 years ago, set a target CalPERS rate that was higher than what we were actually paying out of pocket each year, and that we should plan for that. For some reason, for a very long time, the budget didn't do that. The budget budgeted somewhere, it looked like what we were actually going to pay in cash, what our cash payments were going to be. But about 2 years ago, or a year ago, we finally convinced the finance group to put into the budget the amount of those higher rates that the board had mandated. So my understanding now, and I could be wrong, but this is what I've been told and I've come to believe, is that we are now budgeting for that higher rate that the board felt was the responsible rate to be putting in there. And in addition to that, the board also put additional excess cash that it had, and that was sort of a capricious decision. In other words, it wasn't based on anything except our ability to pay it. We had the cash and we did. It was brought to the board voted yes, and we did it. There's not a scientific plan though to be doing that. So that's my understanding of how it's working right now.
Okay, thank you.
Robert?
Yeah, is it, somebody need to help me out here. Is it, and I'm just taking for what we got right now. Lam, you said that the 16 million is there and it haven't been allocated. Two things. Will we follow previous years' model of taking whatever surplus we have and appropriating it in certain categories? One, what are those categories? I think you mentioned one. Are there others? And is it based upon a percentage, or is it based upon the actual need or expectation? What Chuck just got to mention, I think Jim alluded to, in terms of budgeting more to pay out so that it can meet the targets and the need for CalPERS. So if there's a percentage, then is it possible to look at whatever the balance of that percentage of that number of the total, then look towards to try to figure out or a way, if all other constants are held at bay, look at a percentage to then flow towards this future capital improvement, no matter what it is, whether 16 million this year or 2 million next year. Is it possible that or should the board look at a way in which, when possible, to be able to kind of put aside certain amount each year towards those capital improvements?
So currently, in our process, how we allocate our budget savings at the end of the year, we basically started allocating funding our depreciation for our apparatus and equipment, and any leftovers that are that's created from the budget savings, we would allocate it to our CIP and the UAL as the reserve for paying down the UAL. But there is no mechanism right now in terms of what you're referring is to. Is there like a policy that says that we have to allocate a certain percentage of the surplus or whatnot? So we don't currently have a set criteria where we can allocate. It's just based on the board's discretion of where to allocate.
Thank you.
But may I add, we are working on our revising our fund balance policy. So that is something that we're working on to bring to the finance committee meetings. And in that fund balance policy, the committee meetings and the board members can determine the allocation methodology current.
Yeah, I mean, maybe I'm just old school or no school at all, that it seemed like for every dollar we spend out or have saved, we need to kind of figure out how to, and if we got these home improvements that we need to make, we need to figure out how to finance that thing.
Right.
Through our own money without having to go out and borrow money.
Our chief has a question also. Go ahead, chief.
It's really a statement, and what a good problem to have here. So I've heard it from a number of board members, the desire for a capital projects budget. I'm committed to giving you one at some point in time this year. So, and again, being new to the committee process, I would imagine having a philosophical discussion with the finance committee and seeing what the board's direction is. I mean, once we first and foremost is figure out what our capital project needs are, figure out if we want to fund that with our annual surplus in the form of a sinking fund, and then decide whether on an annual basis whether we want to continue to pay down our PERS liability. We might decide to just finance projects by allowing for a little bit higher PERS rate, and that might be an acceptable solution. But I think we can come back to you and have some really fruitful conversations about how we can finance our future projects. I think you guys are very accurate when you, whatever we have in our reserve balances now, I think once we come up with our capital projects budget, you'll see that we'll have more than 100% of our reserve balances earmarked for future needs. But that would be a good, fruitful conversation for us to have a finance committee, and then whether it's a study session or an open conversation at a board meeting, that'd be, I think, really productive.
Thank you, Chief. Other questions or comments from the board? Um, I do. Was this just information, or do we have a resolution here? Let me take a look.
Well, last year it was a motion to accept the report.
Okay. Can I get a motion to accept the report?
I'll move to accept the report.
Okay.
Second.
Second from Robert. No further comment from board members. I'll go to the public. If anybody on the public has a comment, this would be the time to speak, please.
You could do so by raising your hand or pressing *9 if you called in. And I see none.
Okay, roll call vote, please.
Director Jones?
Aye.
Director Crowley?
I see a finger raised, although she's muted.
I'm gonna, hopefully she can unmute herself. I'll come back to Director
Aye.
Crowley. Thank you. Director McLaughlin?
Aye.
Director Solano?
Aye.
Director Bernstein?
Aye. Okay, thank you very much, Long. We're now, I think you have one more though. You have item number 12 here, which is the budget calendar for this year.
Right.
Go ahead.
Okay. So this is our the district's calendar for fiscal year 2023. The budget process and timeline were discussed in the finance committee meetings, and the committee requested that this be brought to the full board for review and discussions. The calendar did make its round to our attorneys, Nicole, just to take a look at the process overall. We did note what she recommended us to note on the calendar. And this calendar pretty much provides important timelines and due dates for staff to follow in preparing the budgets for the fiscal year. And this is just to for the boards to review and discuss.
I'm going to start with a comment, which I appreciate. I'm looking, if you look at the 2, 3, 4, the fifth row down, or the fifth set of boxes, March 15th, the board of directors is going to get a preliminary look at some of these budget issues and begin to talk about, not looking at every nickel and dime, but looking at some of the bigger issues that need to be factored into the budget preparation, some things that board members feel strongly about. And I'm very excited about this because this will be, for me, the first time that the board really has ever discussed the budget before. I mean, we've always approved a summary of the budget, but the board has never even been given a budget in the past, just the summary. And so I'm very excited that we'll finally be able to do our due diligence here with reviewing that. So we'll be able to look at specific operations or specific requests or items or whatever on March, April, and then in May actually vote for a preliminary budget or whatever the exact wording is. And I don't have the legal wording yet, but we'll take a first vote, we'll put it up for sunshine, and then be able to pass the budget in June according to this schedule. And I think I'm very excited, and I appreciate your work, Long. I'm sorry. I heard somebody else do that, and I've made that mistake in the past. I know your first name is Long. I appreciate the work that you've done to prepare this and so forth. So thank you.
Thank you.
Are there any other comments from other board members?
Let me just make one quick comment. I want to thank Steve for bringing this to our attention, and also for Nicole for working on this. I think this is now, if we adopt this, we're in compliance with the Health and Safety Code. Is that correct, Steve, in terms of a budget calendar?
Yep, this calendar before you is in line with the statutory deadlines.
Okay, so I just want to make that clear because I don't know if the public really understood, why we're going through this right now.
Virginia,
So,
would you like to make a motion to?
Yeah, I was just going to. I was just going to move that we accept the budget calendar for fiscal year 2022 and 23. But well, I'll make that motion. But I just have a quick question.
Let me get a second here. Is there a second for the motion?
Rob
has seconded it. Go ahead, Virginia, for finish.
So, Steve, even though, well, this is, I'm assuming that this will be consistently the months at least when we would have to, you know, deal with the budget in terms of the phasing, you know, like the preliminary budget and, you know, the public availability of the budget. I mean, I know that we're approving this or accepting this for 2022 and 23, but moving forward, this would be applicable for future years as well. Is that right in terms of the timing?
I'm not sure it's a legal question you're asking me, but this general calendar, which calls for A, the adoption of a preliminary budget, B, the sunshining of that budget for the public, and C, the adoption of the final budget based on any public comments received, is in line with the statutory requirements. So as long as you do those three things, we're good.
Okay, so I'm just asking because we're not going to have to deal with this just this year. It'll be in the future as well. So do we have to adopt it for this year only?
So that's not a legal question, really. There's no legal requirement that you adopt a budget calendar. This is this year or any year.
Okay, well, we have a motion on the table for this year. So I guess, Chuck, if we want to do this later on for next year or look at it as a regular occurring thing annually, then we can look at that later. But for this year, we've got this right now.
Virginia, why don't you just put that issue on the agenda for the Finance Committee?
Okay. So Michelle, would you just, if the board, I think, wants us to look at this, I'm happy to put it on the calendar for the finance or the agenda for the Finance Committee, just to make sure that we've got this as an ongoing regular cycle for our budget process.
Noted.
Thank you.
Okay, any other comments from board members? I'll go to the public then. Any public comment on our budget calendar?
And if you do have a comment, you can raise your hand or you can press *9 if you're called in. And I see none.
Okay, roll call vote, please.
Director Jones?
Aye.
Director Crawley?
Aye.
Director McLaughlin?
Aye.
Director Solano?
Aye.
Director Bernstein?
Aye. Okay, moving to item number 13, reports and requests number 13, committee reports. And lo and behold, the first one is emergency preparedness and your report, Robert.
Okay, I sent over to Michelle a copy not too long ago, a few minutes ago, the report. So if Michelle, did you get it? And could you pop it up on the screen so we can all look at it? It'll be very short. I think in less than 3 minutes or maybe a little bit longer, I'll be able to kind of lay out the essence of it, and then we can look at it, chop it up, chew it up, and spit it out again, see where we are.
Okay, I'm having a technical difficulty situation, so please let me have a moment to see if I can resolve it.
Yeah, we all need a moment once in a while, so I could appreciate that. So I can maybe start by saying that the committee met on February 1st of this year, and the committee, as you know, composed of Virginia and myself. And our committee met around 2 p.m. With a Zoom call and the presidents at that committee, who was in attendance besides Virginia and myself, Michelle was there, Ryan Zolikoff, and I think Andreas was at the meeting as well, along with the consultants. The objective for that particular committee at that period of time was to discuss the report by Constant and Associate as it relates to the review of the emergency management and community preparedness services, which the report in and of itself was to address in certain metrics. So the summary of our recent committee work, at that meeting, we looked at, we accomplished certain things. The Emergency Preparedness Committee met as a committee along with the staff, and we focused, the focus of the first meeting was to get an understanding of 4 things. And this is critical, I think, to the understanding of looking at history, looking at present, and looking at the future. And one of the things, the first thing we wanted to understand the history and the purpose of Office of Emergency Management for Menlo Park Fire Protection District. Throughout the report, it talked about Office of Emergency Management and really kind of understand how did this particular entity, how it became very focal point of emergency preparedness. And how long has the Office of Emergency Management been in existence? And Ryan kind of gave us that history, and it's been around for quite some time. He had been around working in that particular area. But still, what does the Office of Emergency Management do? And how is it applicable to today in working with the community group? And what needs was the Office of Emergency Management fulfilling? You know, it's great to kind of know that you got something there, but what need is this really fulfilling in the community, whether or in the district? So we talked about that. It was a conversation around that area. And the last thing we wanted to focus on was what are the Office of Emergency Management goals and objectives, both past and present, and particularly as it relates to moving forward with some of the priority levels and recommendation that was mentioned in the report. So our next step was to we looked at next steps and what that may look like. One of the things that we looked at for next step was to move forward. The Emergency Preparedness Committee would plunge into separating the 5 themes of feedback identified in the Constant Associate report to understand whether we are following emergency management best practices, and if we are not, to determine where areas of improvements are appropriate as it pertains to emergency preparedness. The committee areas of focus and support falls in line with their 5 general areas that came out of the report. And that was to support some type of support for Menlo Park Fire Protection District Community Emergency Response Team, the CERT group, CERT program, and other volunteer neighborhood preparedness groups. Exercise was mentioned in the report, but it didn't really say the types of exercise. It talked about education, but it didn't really talk, and they talked about, Ryan mentioned about certain things that would be offered in the community in terms of education, exercise, and et cetera. But in terms of how that was coordinated or would be coordinated, it was still something that needed to be, I didn't get out of the report. And that's the kind of things that I think is important for us to kind of understand. As a local CERT leader in East Palo Alto, it's important for me to know how this is going to work for me and my team. Also, the third thing was to clarify the responsibility and roles of the cities and towns. The report talked about that and talked about where the responsibility lies, who has it, who's currently taking ownership, who's in the past took ownership or didn't take ownership, and how that's really going to play itself out into tomorrow or today in terms of working with the towns, with the cities, and the counties in terms of trying to make that work. And that also fed into looking at the County Department of Emergency Management in emergency preparedness. How does the county interplay or would interplay with a local district, the fire district, who would have certain responsibility, if at all? And do they really have a role? I don't know. That's something that the report didn't kind of talked about, but it really didn't specify that in terms of an action plan. The fourth one, it would be to evaluate the nature of more staffing for the Office of Emergency Management within the district. It was thrown out what was needed, but it didn't say as to any detail that made me feel comfortable why it needs that extra staff and what the extra staff would do, and how it would lend itself to developing the CERT programs within the community, and in developing a CERT program if it's going to go district-wide. That really needs to be clear, and I think maybe other board members might know, but it's something that it wasn't clear to me, and I don't think it was clear to Virginia either. And the fifth area focusing on was going to clarify the objectives for the emergency preparedness subcommittee, because that's one of the themes that it seemed like had came up over the last year almost. What is the role of the emergency preparedness committee? And as well as the Community Emergency Preparedness Response Team or program. What are the goals and objectives of that? And that's not really clear and wasn't really outlined. And until we can get that level of clarity and understanding, it's hard to kind of develop a program. So some of the next step we thought about was talked about with the EPREP committee will look at the recommendations and priority levels. So there are 6 recommendations that was mentioned in the area, and they talked about priorities. And the report set certain priorities. That's where I differ with the report. It's sort of like emergency preparedness was kind of at the bottom of the list in terms of to get to. And to me, I think that should be at the top of the list. How that would formulate itself and get into some manageable goals and objectives, and all that you can read the report and it'll highlight that. And in particular, we wanted to determine whether they're in line with addressing the needs of the board, of the staff, and of the cities and towns in the fire district, as well as the community-based volunteer neighborhood preparedness group. We thought as one activity that we felt like this in that we need to kind of look at and work on and follow up on was to determine the Emergency Preparedness Committee work schedule. The report has a lot of information there. To me, I think we need to dissect it. And we need to glean out of that things that fit into what the board is concerned with and what the emergency preparedness committees are concerned with, and what the towns and cities are concerned with. That's a work schedule that's going to take to the end of this year. It may not necessarily get completed by the end of the year. It may have fallen, some of it may fall into the next year. It depends on how we approach each area. And to me, approaching it would be more of looking at each one of those recommendations and seeing it revert back to how it fits into what the expectations are. And that's where board expectations need to be. I know Jim has talked about some, Chuck, you mentioned about certain expectations. We need to understand a little bit more. If this report did not deliver that, it may be buried in some activity that with an assumption that if you do this activity, something is going to happen and it may fit and meet people's objectives. I don't know if it will. I don't know. Maybe it is. We need to find that out first. And so part of a recommendation that we want to leave the board with tonight is we may want to extend constant associate consultants contract if needed. I don't know. It may mean that after we look and really dissect this thing, the report and what's in it, okay, we may need to find some other, may need to look at another report, but I would hate to have to spend, I don't know how much money we spend, $30,000, $40,000, $50,000 on a report. And sometime that happens, you may not get what we want. And so it really is going to have to be clear from the board perspective of what is the expectation, what was the metrics for the report, and go seek to understand whether the report actually met those particular objectives. And in some cases it may, in some cases it may not. So Virginia, I don't know if you had anything else you want to add to it, but I think the history that Ryan gave us about Office of Emergency Management was very helpful to put his department into perspective, because it was highlighted, mentioned a lot in the report. And it seems as if the structure is that the community group, the CERT group, and the activity falls up underneath this particular umbrella. And if the umbrella need to have things need to be worked on, we need to figure out what it is we need to aid them in to accomplish the tasks that we want to accomplish in the community. So, Jen, do you have anything you want to say?
No, I don't, Robert. I thought it was very thorough, but I do think that we should, I mean, since we're looking at 3 different types of customers, as we put it when we first started the report, you know, I think that maybe some of the things in Chuck's memo we might want as a board to consider, which would include, let me pull it up. Actually, it was item 10, sorry. Like maybe having this community meeting. I think Chuck, you put that in here. I have to go back to item 10, but anyway, it was in your memo. And I mean, I don't know if there's any appetite for that, but if members of the public and those who do not feel like they have been heard during this investigative research process, you know, I think maybe we as the elected board should, you know, kind of put something together so that at least whatever we need to hear, or members of the public and volunteer group leaders think that we should hear is actually heard. So I'm not sure if the rest of the board thinks that this should be something that we do, but I do think that if it's something that we want to bring back to the EPREP committee, Robert, maybe we should put that on the agenda, or I mean, I don't know how you want to do this. I'm trying to find it here in item 10. I think it's 2B, which is I think Chuck proposed that we have a special study session to listen to community input on the matter in late February. I don't know if that's going to be too soon, but I think the question of whether or not we should even have this study session is the first thing that we decide. And then the second thing we decide is when. But I do think that it may be worth considering.
Yes, my opinion, or you just?
Yeah, no, I'm just putting it out there. I think that if the public doesn't feel as engaged, or if our volunteer groups leaders don't feel as engaged, I mean, they are an important part of what we do and what we need to have our program be successful.
Well, I think myself personally, I think we at some point we need to, as they say, get back out there in the community and talk to the community. But I think I'm hoping that when that happens, it doesn't become one of a blame session, because that gets us nowhere. I think it's important for the EPREP committee, this stuff still lies with the EPREP committee and the board, that we need to have a fact straight first before we run out into the community and saying, okay, we want you to read this report and then tell us what you think. I understand and I get that, but as I said, I think there's history there that we need to understand. So I'll just leave it at that.
Chuck?
Just go ahead.
Oh, sorry. Yeah.
I just want to comment that, I think there is still much work to be done in this arena, engaging, the community, evaluating what we have to offer, AM structure, all the things that we've discussed. Where I'm sorely disappointed in this report is I thought that was going to serve as a catalyst, as a platform to aid that discussion, to kind of serve as a basis, to move forward. I don't think it does. I think it falls well short of that. And I think we need to, I'd like to get a recommendation from the committee. Do we mend it or do we end it? Do we, make our objections and concerns known to Constant and ask them to buff it up, or do we just move on from here? But I'd like to hear a recommendation from the committee. But I do think we need to have a up or down vote on accepting that report. And I say, as it stands right now, I can't support it. Not with the inaccuracies that we know are in there. So that's what I had to say on the subject.
Chuck?
Yes, go ahead, Rob.
Thank you.
Can you put your camera back on?
I've been having issues with this computer and I'm working off my phone again.
Oh, okay.
Yeah, I could put my screen on.
No,
Can you see me?
Go ahead.
Okay. As I said before, I see three major problems with this report. One is the California statutory requirement for the DSW certification, and special districts don't have that authority. And what you had brought up, a study session, and I think a study session here is in order again, because the feedback I've been getting from some of the groups is that once again, OEM isn't really addressing their wants and needs and what support that they want from the district. So as you suggested, Chuck, I think we need a study session, and I think we need a study session soon to go over this report and try to solve my, number one, the California statutory requirement, and who's going to do the DSW designation, because special districts, which we are, cannot. So thank you, Chuck.
Well, let me just follow up though. When you say we should have, I don't disagree with you. It's something I put in my memo, but would you like to make a motion or something that we have a special study session where we discuss the volunteer component of all this?
Okay.
Well, wait, before you go there.
Excuse me, but we don't have it on the agenda, Chuck, and I think we need to finish.
I think we have to schedule a session. I don't feel, particularly in view of Robert's comments earlier tonight, which I don't take issue with, but I don't want to unilaterally schedule a study session without the support of the board to do that. So that's why I was asking if that's something that you want to propose formally. And I think it's part of what we're discussing here. We're discussing the report, and we certainly could do that. Why don't you think about that? And let me go to Virginia, had a comment here.
Well, I was just going to say, kind of to augment Rob's idea of putting a motion together is that your report or your memo it says that it's a special study session to listen to community input. And I'm not sure if that's the same as what Rob is saying, which is a special study session. So I'm not trying to interrupt you, Rob. I was trying to get clarity because that's not exactly what was on agenda item 10. So I wanted to get clarity to support what you were maybe trying to say. So Chuck, I don't know, I think there's a difference between a study session and a study session, like a public workshop kind of thing. So I don't know what you mean. What do you want based on number item 10? And I'm not trying to go back, but anyway, what I'm saying is that if you want community input, like a study session or public workshop, that's, I guess you could call it a study session, but if you want to involve the public, that's a little bit different from just having a board study session. So I'm just trying to get clarity before I got snapped at.
What I was envisioning was something that would be a little of both. But by study session, I mean no action would be taken, there would be no votes or action or anything like that. We simply would have a discussion about things, but probably would be a good idea to listen to the public first and then have a discussion of what the public had said second, and then we could deal with the substance at a future board meeting.
Right, so that could be a public workshop.
Yes, again, I'm not making a legal distinction between these things, but it would be a session where no action was contemplated.
Right, but what I'm trying to figure out is there are probably two different things that you might want to accomplish between a public workshop and a study session for the board. So that's what I think that we have to figure out before we go one way or the other.
Okay, Robert, you had your hand up.
Yes, thanks. And I hope people who are listening don't really take me the wrong way, but if you do, I'm sorry that you will. I'm not interested in meeting with the public again and have another gripe session. I'm not into that. That's counterproductive to what we really need to be focused on. We need to focus on understanding what the information that's before us. We need to bring staff in here. We need to go through those 9 recommendations that talked about. We need to dissect that, and we need to see whether it fits into the 3 categories, that whether the board is getting what it's want, is the community getting what it's want, and it is a whole emergency preparedness program of where is it falling short and where it really need to beef up. You know, I'm not, and unless we got something to give to the community to say that we have looked at this and this is what we have came up with in terms as a board to try to help bridge the gap, because there are complicated issues that, and Rob mentioned about the DSW. It's a complicated issue. Right now, our cities are not taking on that responsibility. Maybe Atherton is, but East Palo Alto, Menlo Park is not. You know, the financial and insurance requirement for that. The district going to take it on? We need to understand. If the district is going to take on that responsibility, we need to understand our financial obligation, and we need to have, there's certain controls about it. I know that the Office of Emergency Management is working on trying to get volunteers, certain volunteers, to if they want to become part of this working group that get called. Here they have to go through certain requirements, and that's part of what they want to try to put together. Now, I don't know anything beyond what that little bit that I know. Do anybody else on the board knows more about that than I do? And if you don't, then I think we need to educate ourselves to that, so that we can kind of make sure that we are speaking to the public about what we know, not stuff that people are coming up and saying and think they know, but they really need to know. And I think the community, the CERT group, would appreciate us more if we come in with some information that we can hang our hats on, saying, hey, yes, this is where we want to go. No, it's not where we want to go, and be concrete solutions to them, rather than hearing. And like I say, I'm not saying it's going to be gripe session, but the last two meetings that, we got an earful, an hour and a half earful about what is not right, rather than what if they're, and it's like everything is going to hell over there, and I know it's not. So whatever the board wants to do.
Okay, any want to hear sort of how do we resolve this? Do we have a community meeting? Do we not?
So I just don't think trying to have a community meeting by the end of this month. I don't think it's necessary. I don't think it's practical. Even March, maybe in March, but the board has to, between now and beginning of March, the committee has to work on structuring, and getting more information so that we can kind of have something to present to the board. I'm with Jim. The report doesn't give us everything that we want to. I think the expectation was, and I don't know if they knew all the expectations or not. And if they don't, then we should fill the gaps before we go to the community again. Because if not, we're going to get the same thing that we got last time. So yeah, I'm agreeing with having a meeting, but I just don't think that should be our priority.
Well, let me say, I had recommended it, but I'm agreeing with you. I don't think we can do this in the next 10 days or whatever. So I think doing it in February is not realistic. So I agree with your point there. Go ahead, Virginia.
Well, that's kind of what I said earlier. But the big question is, should we have this meeting? And if we should, then we can figure out the date later. I don't think February is realistic, but I think I probably differ a little from Robert's opinion with regard to the public. I don't know if it would be a blaming session, but I do think that we are accountable to the people we serve. And I would never, think that we're blaming or that we're receiving blame or assigning blame or blaming anybody. I do think that since our fire district serves our constituents, that they should be able to kind of tell us what they're thinking in a more focused way in this issue of emergency preparedness. And community emergency preparedness has been on people's minds forever. This is not a new issue, but maybe this will be the time that they actually feel like, people who are involved, leaders, feel like that they're being heard. And so I don't think it's a blaming session. And I'm sorry if the Office of Emergency Management feels that way, but at the end of the day, we all are accountable to the public and we answer to them.
My reference was not for what people thought in emergency Office of Emergency Management. Is what my experience have over the last 4 years and sitting in many community meetings have led. Because the last meeting we had was not a pleasant meeting, and so I'm just saying I would not like to repeat that. But the only way not to repeat it is to be able to gather our information and then present what we have to the community, present recommendation, present solutions to the community. But from what I understand, the community wants solutions. They don't want any more talk. They want the solutions to the problems that they're experiencing. And if we have not captured the problem adequately, then yeah, we need to know we need to go out and find and search, and people and the community groups tell us either we we got it or we don't have it. But I think we need to do our best as a board to kind of ascertain what that is before we let ourselves go.
Robert, do you think it would be possible? Two things. One, to have those discuss those recommendations that you're talking about at your next meeting and bring them to the March board meeting. That was the first question. And the second one is, do you think you could also discuss with Virginia the possible format for a community meeting and bring that as a recommendation to the board meeting for March.
Absolutely. The bullet point number B under summary of recent committee report was to look at the recommendation and priority levels and that they mentioned, and then as a group, and then begin to look at that. But yeah, I mean, we can look at, once we look at that, then we can begin to talk about it. Then we can kind of, I would feel comfortable, if we need to set up a meeting with the community, what that would look like, what will be discussed and what the outcomes we would like to achieve from that. And then we can go in with some concrete plan of action with the community.
Okay, well, that would be my recommendation. But Rob has his hand up, and you're going to need to unmute, Rob.
Yeah, thanks. No, I've got to agree with Robert and Virginia. It looks like we do need more time, but Chuck, when you and I were on that committee too, we asked for certain things to be done, like a form for these volunteer groups where they could fill it out and ask for financial support or training or handouts or equipment. I mean, it's kind of like it's been spinning, and we can't make the special district authority relationship to the cities and the county. We can't fix that. I mean, that ultimate responsibility, according to what the state says, falls on the city and the cities, the town and the county, not special districts. So is it that these volunteer groups expect us to take the lead, even though we don't have the statutory authority? I would like to hear from them again. I mean, see what progress OEM has done since Chief Harold had set that up, the OEM group, and see if those volunteers are satisfied. So I think a study session is in order, but I think, Robert's emergency prep group, as you suggested, make some type of agenda for us to have a study session, and try to not make it a fault or pointing fingers, but to try to make it a corrective situation where maybe we can also invite the cities that are and the town that are involved in our fire district and see what their perspective is on it. Thank you, Chuck.
Okay, well, thank you. If nobody objects, and it seems like there's kind of a consensus to send this back to the committee and to get some recommendations that we could consider and discuss and even take action on at our March meeting. I'm not saying we'd enact them. I'm just saying we could, if we wanted to, do that. And two, to get some ideas on what the best kind of forum or way to structure a community meeting on this. And as part of the first part, Robert, I also think, I have a personal opinion on it, but I think that you should please consider what you would like to do with regard to the report, because you mentioned the option of extending it. You had a nice way of saying it, extend it or
if needed,
another report or something. But I think this would be a good time for us just to kind of draw the line of what we're doing at that point.
And I think that's appropriate. We do need to draw the line, whether it's Jim saying that he thought, it needs to be canned, but then what do we replace it with? What's in there? Do we want to? I wouldn't want to get someone else in there to repeat the same thing. Right. So fleshing out those metrics, of what the expectation was, and to kind of really, because I don't know what they all are, and I think and we need to ask staff. We need to work with staff on that, work with the chief on that, and we just need to kind of bring back what we know based upon what's there, and to move forward. But now I feel comfortable to move forward once I know what's in there, and did it meet it? Like I say, some of the expectation may be buried in some stuff that there are assumptions that are being made because of whatever the activity appears to be. The assumptions are built underneath that it may solve that problem, but it may not be. But we don't know until we get into it. And that's getting into the weeds and crawling around, seeing what's up in there.
Well, hearing no objection to having this go back to the committee and having you then make a report at the March meeting, let's go. I don't think we need to take a vote on it. Let's go back. Let's continue. I have to note though that probably this is a record for the longest committee report that
I'm sorry.
No, not you. You probably spoke the least of other people, but we've never had such a meaty committee report before. I will now go to the Human Resources Committee for a report.
Thank you, Chuck. Which is what it was an agenda item tonight where we discussed the unrepresented personnel compensation plan and structured language methodology for our item 2. And our item 3 was to discuss the petition for recognizing Menlo Park Fire Protection District battalion chiefs as certified employee organization. And that's a closed session item that we're going to discuss as a full board. So that's what we discussed, Chuck. Thank you. Robert, would you like to add anything?
No, you did a good job, Rob. Thanks.
Thank you, Robert.
Okay, strategic planning, Jim.
We just had one item. It was the management audit. We went over some details concerning awarding the contract to Triton. We overcame them, and it's my understanding that contract has been signed and is on its way. So that concludes my report.
Okay, and Virginia, finance, please.
Pretty much everything we discussed was on tonight's agenda. And I think that we have some action items for our next meeting. So thank you for that input to the board.
Okay, good. Then let's go to the liaison reports. Atherton.
I met with 2 council members, Manuelian and the mayor, Elizabeth Lewis, last week, just discussed items of mutual concern. They are very interested in ways that we can assist their ADAPT program. I'm pleased that the chief will be at their next meeting. So again, very positive. So that concludes my report.
Terrific. East Palo Alto, Robert.
No, you are the liaison.
I'm sorry. I am negligent. I did not contact them, but I will, and I apologize. So I have no report to make. Menlo Park.
I have nothing to report, but I'll get that whole thing going.
Okay. And then the county is Rob, right?
Yeah, Chuck. Yeah, I haven't. All I did was just inform the 2 board of supervisors that I was the continuing liaison. So that's about that. So end of my report. Thank you.
And then we had an ad hoc committee reports. And I know I got some things Robert, that you sent to us.
Yeah.
And were you going to present them, or how would you like to proceed with these?
Well, I thought what I might do was, one, get you the information that's been on our minds, and set up a time at the next board meeting to be able to get affirmation from you as a board, and to request that not only with the chief, because we haven't really sat down, had a chance to sit down with the chief. The committee wanted to do that, as well as we can coerce the chiefs to pull Francine into this body of thought and information. And so I asked Michelle to send it out to you, and just briefly, just kind of let you to look at, not for discussion. The first sheet, I'm gonna say, which is this sheet, I'm gonna draw back to it because these are our recommendations. But we want you to kind of start understanding what diversity is, because the diversity, equity, and inclusion is a very broad, there's a lot of literature on it. A lot of people got opinions about it. So what I did was kind of extract information from what I did research on, so you can kind of begin to think about looking at diversity. The other sheet I look at is sheet number 3, which it talks about it. I took it from one particular author, which is this particular sheet right here. One particular author who talked about diversity, equity, and inclusion. Thank you, Michelle. And it outlines what does diversity mean, what it looks like. It also talks about what is equity, and it also talks about what is inclusion. So my goal in this particular document, like the one before, was to kind of all of us get on the same mindset of what this looks like, because this whole thing of equity, diversity goes way back to the 60s, 1960s. Some of you probably weren't even born then. It grew out of this old affirmative action, which is the act that took place in 64. And so over the years, that notion of how do we include folks, what does diversity look like, and the equity, it's kind of a recent piece that people are looking at. So I wanted you to look at it, think about it, so that we can have some robust conversation and get the board approval. And the last one.
Let me just stop you 1 second, Robert. Yeah. Is it your request? I've made a note, but I want to make sure I have it right. Is it your request that we put this on the agenda for the March meeting, and you will lead a discussion of that?
Yes, the team will lead a discussion of that, because we need to get your approval of it first. So because you're setting the parameters of the information and the research that we need to do both internally and externally to kind of, so that we can get back to it, sort of fulfilling the purpose. And that's the last page, which is the committee purpose and statement. So with that kind of sets the tone, sets the direction for the ad hoc committee. It's we're kind of creating our own work, because you present, this is what you wanted to the committee want to have, but you didn't give us much meat on that bone. So we're trying to put the meat on the bone so that we can have something to do. And so these are the parts of something to do. The first, so what we're asking for, what I'm asking for, and the committee is asking for, first, that for us to move and launch this EDI ad hoc committee, we're requesting the board to agree on diversity, equity, and inclusion description. Have the board to agree upon the EDI committee purpose. And then the third thing we'll need to have board affirmation on, but not at the next meeting, is to get board general agreement on a timeline schedule to move forward. Because what will happen, and I have put together, I won't show you that paperwork document, is how this thing is going to really come together and what we need to do. So this is just the FYI. I didn't want to go into it too deep. The team has a lot of work left to do to kind of really give you more on assessment, analysis, and best practices, what we could do. And I'm not saying that anything wrong. That's not the point. The point is where are we in relationship to all of this?
I've made a note to include this on the agenda, but I was going to request, Michelle, if you would make a note also when we do the draft agenda to have some item related to this too, to help jog my memory.
I will add it.
Thank you. Okay, we have
hold on, let me add something to that since I'm on the committee as well.
Sure.
So I just want to thank Francine. I think that, she, Robert, as the chair of this committee, kind of asked for her input as well. And so I just want everyone to know that as we move forward with getting some of the purpose and, the purpose statement and some of the definitions down, that we're not working in a silo. We're also including Francine's input from an HR perspective, just so that, we're looking at things not just based on our opinion, right, but based on, what her belief best practices are and, in compliance with the law, I guess, or rules. And one last thing is with regard to this committee, as Robert put it, for the purpose statement, it's for the entire fire district, which would include the board and it would include staff as well. So I think it's a really good thing. I think that we're off to a good start. And, as we develop the definitions with input from the board, I think, we're going to make a lot of strides. I would actually, Robert, I haven't even talked to you about this, but looking at inclusion, I've just been thinking about the definition of inclusion over the last week or so, just because I think it's a culture as well, where we have to look at inclusion more broadly. But it's something that, Robert and I have been thinking about just in general. And so now that, he's put together this document with input from Francine and me, obviously, I think we're off to a good start.
Well, thank you for doing this. And I mean, I was just going to say, I was just stimulated by the discussion of this. I think it's certainly, and I'm pleased that Francine is offering her assistance on this. But I also want to make note that this is broader than just what our human resources practices are. I mean, this involves the service to the community and our outreach and the language we reach out with and all sorts of things. So I think it could be a very broad charge that you could look at. So thank you. Any report at all on water companies and water pressure as an issue, as ad hoc committee?
Yeah, Chuck?
Yes.
Yeah, I reached out to our chief and to get, at least to identify all the water companies that we deal with in the fire district. And then Jim and I,
Rob.
Yeah, that Jim and I will go forward. Jim is the chair of this committee. Jim, would you like to take the ball?
Yeah, I'd like, after we get that list, I'd like to schedule some time with John Johnston and perhaps the chief, and just start to catalog what are the issues.
Great, thank you, Chuck.
Thank you. And I was going to report on the ambulance services, which is that I'm the chair of that ad hoc group, but I don't plan to do anything with it until such time as it becomes an issue that we're going to pursue. And my take on it at this point is that we're not pursuing anything on it at this moment. And it's possible that ad hoc committee will never do anything further if in fact the problem's resolved. So my feeling is that ad hoc committee is on hold for right now.
Chuck, can I make one comment about that ad hoc committee?
Yes, please.
So I do think that it's important to have the ad hoc committee, and so that our staff, especially Chief Lorenzen, understands how important the issue is for us. I mean, it's on 3 committees in our board agenda and this ad hoc committee. So I am hoping that we'll get regular updates on that, and genuine updates, not not anything where it says, oh, well, it's not going to be a problem. I mean, I would love for us to be able to anticipate future problems as well.
Okay, thank you. And yeah, I mean, back when we were formulating this in December, it seemed like it was a hot issue and we're going to have to take immediate action. And it seems to have stabilized a little. And I think there's kind of a wait and see attitude, but at least we have the mechanism in place to deal with it quickly without me having to go to the board and get approval for the ad hoc committee and things like that. So we're prepared to take action right away if need be. So, and by taking action, I mean, we could meet right away and discuss the problem right away. Okay, reports and requests of directors. Virginia, I'll start with you. If you have any personal reports, requests?
No, just that one comment that I made when John Johnston gave his report earlier on the agenda about the fire code or inspection thing. So John, I'll give you, I don't know if he's even on here still, I'll give or you or the chief that address. Oh, I do want to say one quick thing. I've gotten some very positive feedback for Station 4 and the building of Station 4. So I wanted to, I actually stopped by there yesterday. I was on the way, I was driving home and I saw John Hitchcock, and so I just wanted to say hi. And I mean, he was telling me that things are moving along, and there might be some delay because of supply issues or accessing supplies, but the feedback I've gotten from the community is that they're happy that it's there.
Okay, thank you, Jim.
Nothing, Chuck. Thank you.
Okay, Robert.
I have nothing to report. I think I've talked enough tonight.
And Rob?
I have nothing, Chuck. Thank you.
Okay. And then I'll go down to the president's report, and I will say I too have nothing to report. I've talked a lot this evening also. And so I'll move to public comment number 3. Michelle, could you ask for that, please?
Yes, if anybody has any public comment, please raise your hand or press *9 if you called in. And I see none.
Okay, then I don't think we need a motion, so I'm just going to adjourn the open session, or I don't know if adjourn is the correct word for that, but we're going to go back into closed session to finish the second posted agenda item that we began at 5:30 this evening.
And then just to remind, so the members of the public know that you'll then adjourn from closed session back into open session for any reportable action. And then you could adjourn the open session meeting at that point.
Okay. So what are we doing right now?
So right now I need to make the breakout room, and I'm just give me a moment, and then you can all go into the closed session.
Okay. Well, thank you all for coming who are no longer going to the closed session. And that concludes the public part of our meeting until we report back any items from the
and just to be clear, any members of the public that would want to hear any possible reportable action, you would stay on this meeting as it is now. And everyone going into closed session, you should be able just to join. Do you see the ability to be able to join? Okay.
No,
so,
it's not
yet.
on here, Michelle.
Okay, so what I'm going to do is I'm going to close all the rooms and I'm going to make a new room. So bear with me.
Thank you.
I see it, Michelle. Is it room 1?
Yeah, so room 1. So Rob Solano made it in and Francine is on.
I don't see it. I don't have it on mine.
Do you, if you put your cursor towards the bottom of the screen, you should be able to.
I just have leave, as in leave the meeting.
Okay,
I have breakout rooms as a menu item at the bottom.
Okay, do you see room 1?
Oh, breakout room. Oh, okay.
I see room 1.
Yeah. Okay.
So click on room 1 or join. There should be an option to join.
Okay, I see it. I got it.
Okay.
Oh, here. Okay. Okay, I got it too. Thanks.
Thank you.